This COVID-19 pandemic is affecting everyone's lives and limiting access to maternal and newborn care, family planning, testing, and treatment of sexually transmitted infections, especially HIV, and services addressing gender-based violence.
Indeed, and for several reasons. Supply chain disruptions are causing stockouts of some reproductive health commodities at health facilities. Equipment and staff are diverted to fill other needs, mainly COVID-19 related. Movement restrictions are limiting access to health facilities and trapping women and girls living with perpetrators of violence at home with abusers. People are afraid of going to health facilities because of COVID-19.
Yes, the secondary impacts of the pandemic are serious. More unintended pregnancies and unsafe abortions, an increase in sexually transmitted infections and gender-based violence, and even an increase in maternal and newborn deaths.
These are indeed serious consequences, and similar to other emergencies, the most vulnerable populations are most affected, including women and girls, adolescents, migrants and refugees, persons of diverse gender identity and sexual orientation, people living with HIV, people living with disabilities, and those with lower socioeconomic status. So far, however, pregnant women do not appear to be at greater risk of contracting COVID-19.
Yes, that is true. Some adverse outcomes have been reported among infants born to COVID-19 positive mothers, but it is not clear if these are related to the maternal infection. The clinical presentation is similar to non-pregnant women, and there is no evidence of increased risk for birth defects. But we really need more evidence as this is a relatively new virus.
And in regard to breastfeeding, as we all know, it provides optimal nutrition and critically important protection against infectious disease. And exclusive breastfeeding helps babies to thrive. There has been no evidence of the virus in the milk of women infected with COVID-19.
Yes, this information is all very important to know as we counsel and care for our clients. And for new mothers. Key points are: mothers and their babies should not be separated, and we should support clients to breastfeed safely with good respiratory hygiene. COVID-19 positive or symptomatic mothers should be taught to take all possible precautions to avoid spreading the virus to the infant. This means wash hands before and after touching the baby, keep all surfaces clean, wear a face mask while breastfeeding. If expressing milk with a pump, wash hands before touching any pump or bottle parts, and following recommendations for proper pump cleaning after each use. Consider having someone who is well feed the expressed breast milk to the infant.
Yes, and we must also ensure we follow at all times infection prevention and control measures and guidelines. Maternity care providers should be shifted to non-clinical duties to avoid direct contact with clients if they have any current or underlying conditions that could potentially put them at greater risk of having COVID-19 complications.
These are important points. The need for sexual reproductive health services does not stop because of the pandemic. During emergencies, women continue to get pregnant and give birth. The need for contraceptives, family planning, STI testing and treatment, and gender-based violence services remains or becomes even more acute. As midwives, we play an important role in ensuring the continuation of these services and that no one gets left behind.